COVID can have a significant impact on heart and brain health for years after an infection. That's according to a new study. Mandy Gaither with why researchers say everyone who's had the virus should be aware.
In 2020, before vaccines were available, people who caught COVID-19 had twice the risk of a major cardiovascular problem like heart attack or stroke as those who didn't test positive, according to a new study.
What was also surprising is that the extent of that risk did not show any sign of diminishing or attenuation with time.
Dr. Stanley Hazen with Cleveland Clinic is co-senior study author. He says those risks in medical records studied stayed up to 3 years after infection, and those who had been hospitalized with severe illness from the virus were at even greater risk for heart problems.
That is, if similar to the risk of someone who had one heart attack and what their risk for having a second heart attack was.
Hazen says the risk also varied on blood type. Researchers say people with certain non-O blood types like A or B are already at higher risk of cardiovascular diseases, but the study found those with O-type blood who were hospitalized for COVID didn't have quite as high of a risk of heart attack or stroke. While the study did not look at the effects of vaccination on cardiovascular risk, Hazen says since the severity of the COVID-19 infection is linked to long-term cardiac risk, getting protected from COVID-19 through vaccination is critical.
If you have had COVID, I suggest think about heart disease and getting your cholesterol checked and your blood pressure checked.
For Health Minute, I'm Mandy Gaither.
Experts also suggest lowering cardiac risk through healthy lifestyle habits like eating a healthy diet and getting regular exercise.